Welcome to the Pharmacy Leaders Podcast with your host, Tony Guerra. The Pharmacy Leaders Podcast is a member of the Pharmacy Podcast Network, with interviews and advice on building your professional network, brand, and a purposeful second income from students, residents, and innovative professionals.
Hey, Tony here. Just wanted to let you know that I have a bunch of audiobook codes for two books that would probably be relevant as far as this podcast goes. The first one is Unicorn Jobs for Pharmacists, which is really a career guide. I have 125 pharmacists and students in there that most of them have non-traditional careers, and it's something that you can kind of look at to say, okay, well, who do I want to talk to and what direction do I go in? And the other book that I have is the Residency Interview book, which is 100 Strong Residency Interview Questions, Answers, and Rationales. So if you see yourself doing a residency, applying for a residency, that would be one as well. So just give me an email, aaguerra at dmacc.edu. That's aaguerra at dmac.edu, and I can send you back a free code.
Hello, and thanks for listening. My name is Sarah Stallworth, and today I'm speaking with Dr. Joshua Caballero about successful interviewing skills for a faculty position for pharmacists in the academic setting. This podcast is the fourth of several planned over the next year that will focus on developing interview skills for positions in various pharmacy settings. The series is sponsored by Phi Delta Chi Professional Pharmacy Fraternity as part of their professional development initiative and hosted by Pharmacy Leaders Podcast. I'd like to thank both organizations for their support. Dr. Caballero is currently the chair of the Department of Clinical and Administrative Sciences at the Larkin University College of Pharmacy and heads a department of 18 clinical faculty members. Dr. Caballero earned his PharmD at the University of Tennessee College of Pharmacy, completed a residency in psychiatric pharmacy practice at University of Texas Health Science Center, and a fellowship in pharmacotherapy and clinical research at The Ohio State University. Prior to joining Larkin University as the pharmacy practice chair, Dr. Caballero held faculty positions at University of Texas Pan American and Nova Southeastern University. Dr. Caballero, thank you for taking the time to speak with me today.
No, thank you. That was a great introduction. So thank you very much for having me and for your efforts regarding these podcast series.
I'm very excited to speak with you today. Our first segment for today will focus on obtaining a pharmacy faculty position interview. And so I'm just going to go ahead and dive into the questions.
Okay, sounds great.
So first off, what advice would you give to a student or resident who may be interested in an academic career so that they can be more competitive?
I think that's a great question to start off with. I think there's a big misconception for residents or even students that academia is this ivory tower type of position that is typically reserved for elite students and residents. And actually, I have found many of our faculty, while they are elite, it's not just about the grades. It's also about a passion to teach others and really a way to break down complex topics into more manageable topics that other students can understand, and also just have a dedication for the profession. There are non-tenure track positions in which research, even though it will always be a component of academia, it may not be the primary focus. So some students and even residents sometimes are scared off because they feel that there's this huge burden on completing research as the main focus of a faculty positions, when in fact there's two types of positions. There's a non-tenure or clinical tracks, which are more clinically and teaching focused, and then the other ones that are tenure track that are more research focused. Okay. And one of the things that they should be able to be more competitive is just as they're going through their residency experience, usually if they look for a residency that is more focused or affiliated with a university or have more opportunities for teaching, that will give them more opportunities for them to showcase their skills.
Okay, so that leads me into my next question. How important is it that a candidate for a faculty position have experience giving lectures to pharmacy students or other students?
I think it's very important, but it's not completely critical. It's not just to the students. During your residency years, you should have the opportunity to not just provide lectures to pharmacy students, but potentially medical residents and nursing and other healthcare professionals. And as long as you're doing that, you're disseminating information to the masses. And that's typically what we're going to be looking for. We definitely appreciate and love when we do have applicants that have taught within a pharmacy program or have taught pharmacy students and taking them on rotations. However, while that is a skill we definitely look at, if a resident or an applicant that has been completing some residencies may not have had those opportunities, but have had opportunities to teach within other healthcare professions, then we will consider that as well.
Okay. Thank you for sharing that advice. How important do you think it is to obtain a teaching certificate during a residency to be competitive for a position?
This is a loaded question. We always appreciate a teaching certificate, but more colleges of pharmacy and even ourselves in our committee, we really take a close look at not just the teaching certificate, but what were the roles and responsibilities to obtain a teaching certificate. We kind of have taken a position, even myself, that not all teaching certificates are created equally. And there are some programs in which I've seen applicants that have obtained a teaching certificate, but when I take a look at what their teaching requirements were, they really weren't that much. And then at the flip side, I've seen other CVs where an applicant has not had the opportunity to obtain a teaching certificate, but they were involved in teaching 4 or 5 didactic courses to the PharmD students. They were involved in teaching elective courses. They were involved in precepting students. So they have all these other skills and responsibilities that they were able to do. They were just not affiliated with being able to obtain a teaching certificate. So even though that looks good, we usually comb through the CV to see where these opportunities are. So it's very important that as a applicant to a faculty position, you're able to detail in your CV what responsibilities or what were the requirements of your teaching certificate.
Okay, that definitely makes sense. So you mentioned earlier that research is not completely just a focus for clinical pharmacy positions. So should an applicant for a faculty position in clinical pharmacy have research experience?
Yes, they definitely should. And usually what we look for is, I know it's very difficult for during your PGY1 and PGY2 to be able to completely fulfill your research requirements. And sometimes most of the applicants can get it to the poster because most people have to present at ASHP. So by the time that you go through the steps, we want to see what are the research projects that you have been involved with and what the stage is and what role you've played within the research. Typically, I guess this goes a little bit more if we do screen, at least with us, we typically will screen with a phone interview. And it's during that time that we will gauge more information and more of an understanding of what your role within the research experience was. If you're able to take the research and take it from a poster to submitting a manuscript, or even better, publishing it, that goes a heck of a long way of setting yourself apart from other applicants.
Okay, thank you. Thank you for sharing. That's really helpful information. But that leads me into my next question. So, should an applicant for a clinical faculty position be published? And if so, what would you recommend in terms of number of publications and quality of publications?
So I have seen a wide variety for non-tenure track clinical faculty. We typically would like to see and discuss the stages of where the manuscript is, where it stands. I've had faculty that have come in with 0 publications, but have had their projects and research in process and finishing up. And a lot of it is communication with the applicant and the faculty member and trying to decide what stage they need and what they need to be successful. So as a department chair, I usually will make sure that I provide them with about a 3 months, 6 months to kind of get settled in. Sometimes they'll have lectures right away, depending on where the topics fall within the blocks. But usually I want to be able to give the faculty member the opportunity that they just finished their PGY2. If they finished a PGY1, they pretty much jumped right into a PGY2, and sometimes it's very difficult to even complete your research from PGY1 year during your PGY2. Sometimes it's easier if you're in the same institution and we're able to early commit and continue. But what I typically have seen is that my faculty are able to publish and work and submitting and publishing their residency research within the first 1 to 2 years of academia. So I think it's more of a, what's the status of your research project? What have you done? What's your passion towards it? But if you definitely have been able to publish case reports and other things, that really does go a long way in separating yourself, even for a non-tenure track. So it's really not as much as a number, because it's not just about the research. We've had some people that have been a lot of potential for research, but a lot of the other, say, tangible aspects of the candidate are not what we would state as desirable to be a faculty member. So in other words, personality issues, people when they come to interview need to realize that by the time we're giving you a call, whether it's for a phone interview or an on-site interview and so forth, we pretty much have figured that you can do the job, that you can do and fulfill the requirements, that you're quote unquote like smart enough. It's more of a personality. And does your personality fit with the rest of the department? So as far as a number goes, we really don't have a number. It's definitely a step in the right direction, but it's not the all-encompassing, all-inclusive.
Okay, that's great information to know. As a P3 student interested in pharmacy academia myself, I'm just wondering, what are your thoughts about pursuing academia fresh out of pharmacy school or residency versus having practiced pharmacy for a period of time?
So I lean towards a preference for those coming right out of a PGY2 or fellowship. At that point, your research is still in the works, and it tends to be an easier transition into a faculty role. In my experience, when I've had faculty that have joined after several years of being in clinical practice, or either they don't have any research that they can conduct and it takes them a very long time, or they just can't do the research portion, or they have engaged at such a high clinical practice that it's tough for them to let that go and understand that the role is first to the college, not to the clinical site. So, for example, in the positions that I have hired, they're 100% funded through the college. So your responsibility first goes to the college and the students. Then it's to your practice site. And sometimes clinical pharmacists that have been in a clinical setting for several years, it's harder for them to be able to make that split where they say, oh man, I can only be at my practice site 2 to 3 days a week. And then that kind of, they almost try to do too much from a clinical aspect, and then they end up getting burnt out. Or it's not what they expected. I have had, unfortunately, that some clinical pharmacists think that academia is easier because they just teach a little bit and they can do the practice side a couple of days a week and everything is hunky-dory. But it's once they find out all the service component, the teaching, and the other responsibilities that come with being a faculty member, and that you do take work home with you, that it's just different. So I just feel and see that those that jump out from a PGY2 or fellowship and jump straight into a faculty position, their adjustment tends to be better. Not saying that a clinical can't go and that I wouldn't hire a clinical pharmacist, but just the transition is different.
Okay, thank you for sharing. That's very interesting information. So what qualities in general do you look for in a competitive candidate for a clinical faculty position?
So one of the things and qualities that I first look at is just the attitude. If you have a positive attitude, it really does go a long way. I ask a lot of situational type questions. So I tend to ask, one of the questions I like to ask is, tell me a conflict or a situation that you had with another individual in which no matter what you did, you didn't get the outcome that you wanted, and what did you learn from it? And those type of questions lets us know, not just myself, but the rest of the committee and those that are interviewing, how the candidate, how the applicant will do within the department. Outside of that, I want someone who is willing to ask questions, that is not afraid to ask for questions, that wants to further themselves, obviously that has a passion for the students. If I don't have someone who is interested or vested in being able to provide the best education for our students, then it's not someone that I would be looking for as a faculty member in these non-tenure clinical track positions. Obviously, if you're interviewing for a tenure track position, then your focus is mostly research. You still have teaching, but it's not the primary focus.
Since you mentioned tenure in the process, can you briefly describe how the tenure process works at your institution?
Sure. So, and I'll talk about it in general. So usually the way tenure and non-tenure works, and I think this is kind of important for students to understand. When you join a tenure track position, you're pretty much on a clock. And it could be anywhere roughly between 5 to 7 years. And different universities have different requirements, but in general, they would expect that by year 5 or 7, the majority, if not all, of your salary is funded from outside grants. And so the first couple of years, they're supporting you. And then some programs will have metrics. So, for example, they may say, all right, after 2 years, we would like for you to have 20% of your salary funded. And after year 4, you should have 40% of your salary funded. Again, these are just rough examples. Each institution is different. So right off the bat, they're on a clock. So the majority of their time is writing for grants, finishing up research, trying to do some preliminary studies to be able to build preliminary data to publish, and then use the preliminary data to seek funding at a higher level. And then if after the 5 to 7 year mark, let's say 7, you're able to have high impact publications, you're bringing in significant funding, and so forth, then you may be granted tenure. And basically, tenure means that you have a position theoretically for a very, very, very long time. There used to be the adage that if you were tenured, you pretty much had your salary paid for the rest of your life. And some colleges have noticed that after someone attains tenure after 7 years, they basically stop producing, and it equals like dead faculty weight. And then that has created, so even some universities are now evaluating what the requirements after tenure would be. But that'll be for a different podcast. Now, looking back at non-clinical will go start off as an assistant professor, and you would be a faculty. And during this process, you're evaluated anywhere again between 5 to 7 years. And during that time, they're looking at the significance of like how your teaching is, how you are at your practice site, your service not just to the college but to the profession. So usual requirements for associate professors, high teaching evaluations. You need to have some publications. Very few promotion guidelines will actually have a number, but I've seen some institutions promote, not where I've been at, but I've seen some institutions promote someone to an associate professor with 2 or 3 publications. Normally with non-tenure clinical track people, and again, this is a rough estimate, could be anywhere from about 10 to 15 publications. And then they kind of want to see your contributions to the profession needs to be at a local or state level. So if you're giving CE presentations to for example, the Tennessee Board of Pharmacy, the Tennessee Pharmacy Association or the Florida Pharmacy Association, and some of the more local state organizations, then that usually will merit a promotion to an associate. Obviously, you got to have good teaching evaluations, and what I like to say, played nice in the sandbox, which means during your time at the university, you're not someone who's creating problems. Just get to work, do your job, be nice with everybody. Not every day is going to be rainbows, ponies, and unicorns, but are you, and sometimes you may have a bad day, but overall, are you good and pleasant to work with? From your teaching, it's not just evaluations. Are you submitting your syllabus on time? Are you having your lectures posted on time? Are your questions for your exams posted on time? And those kind of things. Then after 5 to 7 years, and you apply for that, and you're able to get, and there's really no timeline. So for clinical assistant professors, normally, it's just whenever you're ready, you're ready. But they typically look at anywhere 5, 7 years or so for you to apply. It's not like if you have to apply by year 5 or 7, and if you don't get it, you're out. That's just a promotion aspect. To go from associate to full professor, and they just call it professor, but it's technically a full professor. You won't see that in the heading on the signature line. You'll just see it as professor, and that typically involves more. Do you have a reputation more at a national level? Have you had contributions that have affected the profession at a national level? So it could be through a book, it could be through the major publications, it could be through providing lectures and or CEs at the national level. So in organizations like ASHP, ACCP, AACP, those kind of venues. And then also from a publication standpoint, and funding. So for associate, if you have secured internal funding or funding at a local or state level, it's usually pretty good. For full professor, if they look more for funding more at a foundation grant or at a national level, NIH, the Corey grants, things like that. And then from a publication standpoint, again, it ranges usually in the 30s and 40s is for a full professor. One of the things that I do remind my faculty is that for promotions, especially my younger faculty, where we're in a instant gratification type stuff, is that, promotion is more of a long distance race, and people should be taking their time. I sometimes have faculty like, I want to be promoted within 3 years, and I'm like, don't be so hard on yourself with the clock. Just take it year to year. For a non-tenure track position outside of the promotion, you generally have anywhere from 2 to 3 year contracts, and that's just for continuing contracts. So continuing contracts runs different than being promoted. Continuing contracts are usually looked at as, are you hitting your typical metrics? And I look at continuing contract as, are you doing C work? For lack of a better analogy, are you doing enough that you're keeping everybody happy? You may not end up being a rock star, but we would like everybody to be a rock star, but that just doesn't happen. So are you doing enough of your teaching that again, you're not a complication or being a hindrance to our department? Are you publishing the bare minimum? Some institutions require one publication every 2 years or 18 months. Most non-clinical tenure track positions, what I've seen, is about one publication a year. But again, those are rough estimates.
Okay. Thank you for sharing about that. Just the tenure process in general. I've always been really curious about how that works. Before I transition into our second part of the interview about actually what to expect from a pharmacy faculty interview position, my final question about securing an interview is, what is the typical application process regarding timelines and required materials?
Yeah, perfect. Usually what's going to be required is going to be obviously an updated CV. So your updated CV should include where you completed your PGY1, currently completing your PGY2 residency, your research projects that you're ongoing, and the abstracts presented. And also, if you're having a teaching certificate, at the bottom of the teaching certificate, very roughly kind of state what the requirements were for that, just to give us an idea. Along with that is a letter of intent or personal statement. And those are typically about 1 page, and it's for you to basically discuss why you want a faculty position and what you bring to the table and what you would like from the faculty position. And then usually we also ask your teaching philosophy. And that's usually about 1 page of what your teaching philosophy is. And then finally, 3 references. You don't have to send us the letters of references like you do in forecast and upload and all that stuff. We normally do that at the end. So for the initial, we just need the 3 names with their contact information.
Okay.
That's it.
Okay, that is very, very helpful information, especially with just getting all your materials together for the application process.
Support for this episode comes from the audiobook Memorizing Pharmacology, a relaxed approach. With over 9,000 sales in the United States, United Kingdom, and Australia, it's the go-to resource to ease the pharmacology challenge. Available on Audible, iTunes, and Amazon.com, in print, ebook, and audiobook. Thank you for listening to the Pharmacy Leaders Podcast with your host, Tony Guerra. Be sure to share the show with the hashtag #PharmacyLeaders.